In this video, we will show you the features and benefits of using a HoverTech air supply and how it's used to inflate HoverTech air-assisted devices. We will demonstrate using an HT-Air 1200 air supply. All HT-Air air supplies have an LED control panel, 3 buttons that initiate airflow, and a standby button that stops airflow. The adjustable button, also called the safety button, is on the far left. This offers 4 levels of low-volume airflow. When pressed, the LED light will blink to indicate the level of airflow. The adjustable airflow feature allows it to be used with all HoverTech air-assisted devices. You will also use the adjustable button to gently inflate an air-assisted device for patients who are anxious or in pain. This feature can also be used to determine product placement under the patient prior to full inflation. The standby button is the second button from the left. When the air supply is plugged to an electrical outlet, the standby button power indicator illuminates. Press the standby button anytime you need to stop airflow. This is not an off button. Power will still be supplied to the device after the standby button has been pressed. To the right of the standby button are the airflow buttons for hover mats and hover jacks. The button labeled 28-inch and 34-inch hover mat can be used for all 28-inch or 34-inch air-assisted devices. The button labeled 39-inch and 50-inch hover mat and hover jack are used for the larger 39-inch and 50-inch air-assisted devices, as well as for inflating the HoverJack family of products. The HT-Air features a patented ergonomically designed handle and hook for both carrying and attaching it to the end of a bed or side rail. To remove the hose on the HT-Air supply, push the button located on the attached hose cuff at the top of the air supply. While pressing the button, pull up to disconnect the hose. To attach the hose, press the button on the hose cuff and snap back onto the air supply. The hose can be looped under the air supply and snapped into place. The hose cover fits snugly on top of the hose to prevent fluids and/or debris from entering the hose when it is not in use. When not in use, the power cord can be wrapped and secured with a black snap attachment band. The HT-Air supply has 2 vented filter ports located on both sides of the air supply. To change the filter, begin by removing the cover with a Phillips head screwdriver. Remove the existing open cell foam black filter and replace it with a new filter. Reinstall the cover and repeat on the other side. The 25-foot MRI hose enables caregivers to use products in MRI by keeping the air supply out of the imaging environment. HoverTech's air supply hose cover is a convenient, disposable cover that protects the entire length of the hose from getting soiled. It is especially useful for infection control and high fluid areas. To learn more about HoverTech HT-Air supplies, please go to the hovermat.com website.